Hello, a very good morning to all of you. This is Dr. Harpreet Isher, fetal medicine expert, talking from Chaitanya Motherhood Clinics today. And in the today's topic of discussion today, the webinar topic is on the tests which your obstetrician or your fetal medicine expert will mention to you. So it is important that you understand the meaning of these tests. So there are 4 tests which you may come across: dual test, triple test, quadruple test, and NIPT. So first of all, I will explain to you that why these tests are important, what are useful for, how much information these tests will give you, and how much you will need to find more if there is something wrong with these tests. So there is nothing like a perfect world and perfect people. Errors happen in nature. So when a baby is being formed, what happens is there are 23 packets of information which come from the father and 23 packets of information which come from the mother. So 23 plus 23 makes 46 packets of information, which becomes the code of the baby, of how this baby will develop, how this baby will form, what form it will take place. It's very important that the 23 chromosomes, which is the packets of information that I'm referring to, the medical term is actually chromosomes, that these 23 packets from the mother and 23 packets from the father, they are complete and no part is missing or duplicated. Each packet also contains grains, and the grains are equivalent to the genes. You must have heard this term often being said that ये तो genetic condition है. So what do you mean by genetic? Genetic means something which has happened due to the process of birth, due to the process of your existence when you were being formed. Okay. So if there is something wrong with the number of the packets which are coming from the mom or the dad, or something happens when this baby is developing, that some packet of information either gets duplicated or gets damaged, maybe a part gets damaged, maybe some grains get damaged, maybe it starts leaking. So whenever the intactness of the packet is lost, it will result in some chromosomal or genetic error. And this error will manifest in the baby in some kind of malformation or several malformations or several defects, which we can group into something what we call a syndrome. There are innumerable number of errors which can take place and can lead to different kind of syndromes. We cannot go around looking for each one of them. We have to focus on the ones which are more common and which the nature allows to carry on. So one of the most common cause of mental retardation is Down syndrome. We call it the Down syndrome because it has several features. These babies have several features, which includes the type of facial features, their IQ, certain defects that they have in the heart or in the blood system or in the other systems of the body. So what happens in Down syndrome is that one of the chromosomes, which is the chromosome number 21, that is the packet in number 21, it rather than having 2 packets, the child has 3 packets of 21 number chromosome. And because of this extra information, the formation of the baby is not perfect. All these tests that we offer you, their main importance is in detecting your risk of having a baby with Down syndrome. They give us information about a few other syndromes, but nothing more than that. So as I said, there are 23 packets from the mother and 23 packets from the father. These are called chromosomes, right? So all these tests will give us information about some chromosomes, but not the whole set of chromosomes, okay? Most commonly, we are talking about Down syndrome. Now, when you have to choose which test to have, there are several things that one has to keep in mind. So when you're with your doctor, number one, at what period of pregnancy you are seeing your doctor. Number two, whether you have had an ultrasound or not. Number three, what is your previous history of previous pregnancies or any significant family history. The dual test, the triple test, the quadruple test, and the NIPT, they are all screening tests. So as I explained to the patients who come to us, screening is something like the screening you have in the airport, where when your baggage passes through the screening machine, it basically picks up things which are improper, right? So, but they have to open up the baggage to see what is improper in that, right? So, in medicine, when you do these screening tests, whether it is the dual test, the triple, the quadruple, or the NIPT, you basically screen for, is there something wrong? Is there a risk in this package? If the answer comes as a high risk, or sometimes even a moderate risk, then you have to go on and look into the package. Okay? So, the dual test is a blood test. They're all blood tests actually. If you ask me which is the worst test out of all these, it's the triple test. So that is the test which has the least ability to pick up a problem. These tests are best combined with an ultrasound because we have to look at certain features on the ultrasound and then we have to take your blood sample and then we combine this information and then we determine the risk in your pregnancy of having a baby with Down syndrome. So dual test is done in the time window of your pregnancy when you are between 11 to 13 plus 6 weeks. The quadruple test and the triple test can be done in the second trimester, especially for those patients who have missed this first opportunity. So they can have the quadruple test, which is done between theoretically speaking, we say between 15 to 22 weeks, but actually the best time is around 16 to 18 weeks. And then you have the NIPT, which can be done anytime in pregnancy after 10 weeks of gestation or pregnancy. The dual test, the triple test, and the quadruple test, these three are one category of tests because in the blood, these tests look for certain hormones or certain biochemical substances which are secreted by the placenta. Placenta is the organ which gives nutrition to your baby. So when there is something wrong with the hormones which are produced by the placenta, we have an indirect association that this hormone is low in this syndrome or this hormone is high in this syndrome. And therefore, we have an indirect estimate of you having a low risk, moderate risk, or a high risk of having a baby with Down syndrome. On the other hand, NIPT is also a screening test, which will only tell you about your risk, but it is also a blood test. But the important thing is that it is not looking at the hormones which are secreted by the placenta, but it is looking at the DNA of the baby itself, which is circulating in your blood, that is the mother. So the mother has the baby in her womb. There's a very small fraction of the baby's DNA, which is also circulating in the mother. So this is an expensive test because it actually extracts the DNA from the blood of the mother. And because it is looking directly at the DNA of the baby, it will give you the information with the maximum confidence whether this baby has Downs or not. So if your NIPT report says that you have a low risk of Down syndrome, you be reassured that it's very, very unlikely to be a Down syndrome. On the other hand, if your NIPT report says that you have a high risk of having a baby with Down syndrome, it means that you definitely need to confirm it with the direct test, where the fluid which is directly around the baby is taken from the mother's tummy and sent for testing. And that procedure is called amniocentesis. And that is done whenever any of these results will show a high risk report, either on NIPT or on your dual test or on your quadruple test. The dual test, the quadruple test, they will also give you results as 1 in, let us say, 1,000 or 1 in 100. So these figures, figures only tell you about your risk of having a baby with Down syndrome. For example, if your result of the dual test or the quadruple test comes as that your risk of having a baby with Down syndrome is 1 in 10,000, it does not mean that you don't have the risk. It just means that if 10,000 moms are tested, one of them would be Downs. So that much is your risk, which is extremely low. On the other hand, if you have a risk of, let us say, 1 in 75, that means if 75 mothers are standing, one of them is likely to have Down syndrome. So that much is the risk in your pregnancy, right? So generally, we do not put a needle inside the mother's tummy, that is amniocentesis, in all the patients, but we put it in those in which the result is high risk. Having these tests done, whether it is the dual, the quadruple or the NIPT, you need to ask yourself whether you want to know if your baby has the Down syndrome, number one. Number two, you will get information about a few other syndromes, but not about every other chromosome. And number three, if you do get the information that you have a high risk of having a baby with a Down syndrome, will you go for amniocentesis? If the amniocentesis report confirms it to be a baby with Down syndrome, will you terminate the pregnancy or continue the pregnancy? So if any of these questions, if you're not going to terminate the pregnancy, if the decision is not going to change your approach to your pregnancy, then really you have to ask yourself that why do you want to have these tests done? On the other hand, there can be a patient who says that I want to be 100% sure that I have a nearly perfect baby. In that case, the best test is to put a needle inside the mother's tummy and send the sample directly of the fluid around the baby, send it for genetic testing. So, in conclusion, NIPT is the best screening test, but it is an expensive test. NIPT will tell you about, with maximum confidence, about Down syndrome and about a few other syndromes. If on ultrasound there is any structural problem in the baby, just do not go for NIPT. You may need to have the direct test, which is the amniocentesis. Between the dual, triple and quadruple, triple test is the most least sensitive test. Dual test is the best test done. It should be done when you get your ultrasound done at 11 to 13 plus 6 weeks. So these two things happen together. If you have missed it, you can do the quadruple test. And then you also have another option, like in our center, where you want to really increase your chances of knowing with the maximum confidence of whether this baby has a Down syndrome, but you don't want to go for a very expensive test like NIPT. In that case, you can have a dual test and you can also have a quadruple test, but that should only be done from the same place and from a lab which can integrate the two results and then give you your final risk. So this information is a little complicated, but it is important for you to understand when your doctor tells you that we are sending a sample for dual test, of what it means actually. Because if the result is low risk, then it's not a problem. But if the result comes as intermediate risk or high risk, or NIPT it comes as borderline risk, that is when the confusion starts of what this result means. What do we do next? Most of the times, the final results come out okay. But yes, there is a whole lot of anxiety that starts once any of these results show anything more than the low risk. So I hope I have been able to give you some useful information, and all wishing you all the very best in your pregnancies. Thank you.